Hi, my name is Deborah Doroshow, and I'm a medical oncologist from the Tisch Cancer Institute at the Icahn School of Medicine at Mount Sinai, talking about vaccinating the most vulnerable, COVID-19 and cancer. So, I want to share with you today a few of my key takeaway points from this talk. First, we've learned that patients with cancer unfortunately have an increased risk of both getting COVID 19 and of dying from it compared to members of the general population. Unfortunately, these patients have not been well represented in pivotal clinical trials of the vaccinations which have to date been authorized for emergency use by the FDA. Luckily, after treating many hundreds of thousands of patients with cancer, no new safety signals have been seen to date for patients with cancer who have received COVID 19 vaccinations. A substantial body of data suggests that efficacy, at least as measured as antibody titers, may be somewhat reduced, especially for patients with hematologic malignancies. The timing of how we ought to best integrate vaccination with anti-cancer therapy is still poorly understood. However, there is a consensus that we should wait 3 months after patients have received a stem cell transplant, whether autologous or allogeneic, or cellular therapy, such as CAR T cell therapy. Real world data presented at ASCO this year suggests that there have been no new safety signals for patients with cancer receiving COVID vaccines, and that they are indeed well protected against getting COVID. However, vaccine hesitancy does persist, albeit in a minority of patients, and will be an important topic to study further and think about further as we discuss vaccination with our patients.